Hello, my name is Mchanita Mandara. I'm the cervical cancer screening and treatment and HIV integration manager with OPHID. So I'm going to talk to you about cervical cancer and the importance of cervical cancer to everyone really, not just women, because it's something that affects the whole community. Maybe the focus of my discussion or the focus of my talk with you is about why is it important for anyone to be screened. Globally, cervical cancer takes about 1 in 3 women. With in Zimbabwe, 33.4% of all black women who develop cervical, out of 100, who develop cervical cancer. The thing about cervical cancer is one of those things that you can be going around in your normal business, having no issues at all, and you're being eaten away slowly without noticing it. When you start hearing somebody complaining about having back pain, having leg pains, or having problems with their period, sometimes it's a bit late for them to be treated. So it's very, very important that we get to see women very early, so that we get to treat them or get to give them different options that may let them live longer. So the focus of cervical cancer screening with OPHID maybe started about a couple of years ago, when we noticed that there was a shift in terms of the women who are living positively with HIV. Before, people used to have HIV, AIDS, and then people used to just die within a short space of time. Now, with the introduction of ARVs and people getting more compliant and taking their medication regularly, people are actually living longer. HIV is no longer much of an issue that people are getting to become having AIDS-defined conditions. It's just like any other chronic condition, like BP, diabetes. People are taking their medication and living their lives as normal. Unfortunately, the paradox to that, pertaining to cervical cancer, we're seeing more women now. The HIV is not killing them, but the cervical cancer is killing them now. Why? Because women who are HIV positive are 4 to 5 times and at a higher risk of developing cervical cancer. Cervical cancer is caused by a virus called HPV, and it takes up to about 5 to 10 years for anyone for it to develop to cancer. But in women who are HIV positive, within a year, we can see some severe changes or some serious changes on their cervix that can lead to cancer. So we're saying it is important for everyone who is HIV positive to be seen every year. Our screening program is just in line with what the Ministry of Health has been doing for the last few years. And our screening program is free to all women who are HIV positive, including those who are also negative. What we're wanting to do is to try and catch the women before the disease progresses. What we are looking for is precancerous lesions. Trying to be as late as possible. Precancerous lesions, I'm just talking about getting the eggs before the chicken comes. If we get the precancerous lesions, we're able to treat the lesions before they go any further. We've got about 3 different kind of treatment that we can offer. The cryotherapy, where we freeze the whole cervix with nitrous oxide for 6 weeks. When the cervix starts, the freezing starts to go away, the eggs just falls off. Or we burn it off with a thermocoagulator, just a probe that we put on the egg. We burn it off. 6 weeks down the line, the wound is clear, the eggs have burnt off. Or we cut it off completely with an electric wire, which just takes off the area where the lesions are. And we've seen more than 95% treatment rate due to these initiatives that we can use. So it is very, very important that women comes through, because once a woman, especially between the age of 25 to 49, these are the most productive people in the community. They are the ones who are actually bearing children, in young marriages, the members of the community vibrant. So if we lose those people in the community, we have affected a lot. So we're also saying, we're encouraging men to be aware of the cervical cancer scenario, so that if the woman gets affected, she wants to be treated, there's going to be 6 weeks of abstinence. It's not a shock to a husband to be told that we're going to be abstaining for the next 6 weeks because I've just had a treatment. And if cervical cancer gets into a family, it's just not affecting a couple, it's also affecting a brother, it's affecting a son, it's affecting a father. So we would like everyone to be involved. And male involvement at this point is very, very important. Thank you very much.